So this is where it gets complex really, really quickly. But essentially what we're looking for is pretty much increasing tolerances. So increasing tolerance before you go into a panic attack or switch alters or go dissociative or have some other kind of activation, right? And so the real goal is to figure out ways for the individual to navigate their landscape, their internal landscape of highs and lows, and everyone's going to have a very individualized thing. You have your pillars of identity, how you see yourself. And especially with trauma, pillars of identity can be wounded or cracked or even completely dissolved based off of trauma. So with that, one of the things that we're looking for, do you have any pillars of identity? Are there things within your life that are fundamentally you, how you identify as a person? Someone may be like, I'm really artistic, no matter what variety of like my sense of self, the time of year, I am artistic. And I like, sometimes I have like my stretches of not being and doing art, but like that usually hurts me. I really am this. Okay, cool. That's a pillar of identity. We're going to leave that the hell alone or foster that. We are not working on picking apart anything that is load bearing in the personality right now. We are working on exploring and expanding the sense of identity, especially if there's been damage to a sense of identity with an aspect of trauma. So trauma can shake your sense of trust in self, trust in others, ability to engage a moral code, like religious trauma, an identity with a particular belief system or denomination. There's a lot of ways in which trauma can destabilize one's identity. So what we're trying to do is identify if you have pillars of identity that are still left and keep and shore those up, while also kind of exploring the pain center of where this crumbling sense of self has gone, if there is one, if there's a way to begin to rebuild and analyze those things. So some of this is going to be physical and some of this is going to be intellectual, but it's a combination of the two, because we have to work in a place that not only helps calm the kind of human animal that we are, but also the intellectualization of our narrative belonging, our sense of self, our identifiers, the labels we hold, all of those things that play into our sense of who we are, what our narrative is, where we belong, to whom we belong, and all of those kinds of things. So what we're looking to do is give people both tools that they can use, which is what a lot of therapy modalities do, but what they fail at very often is getting the person into the state of mind they need to be in order to actually access those modalities. There's a reason why in basic training, the training is done under high stress. The training is done under high stress because in that high stress environment, giving the training and the repetition and the ability to engage these things under that kind of stress allows the brain to access it in that activated state. A lot of therapists will provide you modalities when you're nice and calm, but that doesn't mean you can access that functionally when you're in an activated state. So a lot of this is actually learning to essentially psychologically edge to the point right before you click over. So you're increasing tolerance to the edge of that frustration level, to that tolerance of whatever it is. So if malls are a big problem for you, for example, it's going up to the edge of whatever you can tolerate right now. Is it thinking about a mall? Is it listening to an audioscape of a mall in a safe environment? Is it driving to the parking lot of a mall? Is it walking through the doors? What level of tolerance can you deal with in this right now? And what can we do to help expand that to the next step without clicking you over into dissociation, panic attack, altered state, whatever else? And so it's about stretching that and having a professional hold your hand and swing hands with you as you move into those spaces to not only remind you, hey, you do have these tools on hand. Hey, you do have a backpack full of tools that we talked about, remember? And then can help you through that activated state into a place where you can begin to integrate some of these new landscape aspects into your sense of self. And then you move past some of the things that have happened and you begin to integrate new labels, new identities, and new experiences as part of who and what you are. Now, in sometimes in this, we will find something like a load-bearing structure of neurodivergence. So sometimes when you're handling lots of trauma things, you may find actually there's sensory integration under here. And my issue with malls may be helped by taking my trauma about, let's say, a mass pew-pewing incident that I've been exposed to. I can calm down about that part, but the sensory integration part of loud people screaming in a very echoey kind of space is still present. right? So we're not going to keep trying to shove at that. That is a load bearing part of who you are. That's just a preference now. It's not part of a trauma response. Now the question is, how do we cope and create strategies around your neurodivergence or disability or differences that allow you to cope with this, that isn't now within the realm of hypervigilance or anxiety. It's more about trying to accommodate yourself. So again, this is very, very complex, but a lot of it is about tolerance. It's understanding your cycles of hormones sometimes, even through the year, like, seasonal depression or monthly cycles or even daily cycles of times of day where you may have elevated mood or lesser moods, because each one of us has our own little biochemistry that plays out with this. And so a lot of it is determining what factors are playing with you and having a professional kind of hold your hand and walk around the internal landscape you have, going, hey, okay, so what we have here, this is a minefield, and in minefields, this is how we're going to plan to walk through the minefield. All right, this is how we're going to set flags on things, and then sometimes we're going to do like strategic detonation to make sure that we've handled that this particular area is cleared, right? And then we can put our nice little flags up and show that this has been done, and these are the ways that we're going to engage that. And so sometimes it's going to be physical and sometimes it's going to be intellectual. And sometimes that's going to include medications like a beta blocker, where you can suppress some of the physiological responses of stress in a way that allows you to intellectualize for a while and then slowly taper off that. So then you can handle with the physiological responses as you have the adrenal floods start to come back slowly. And then you can use the tools you've already developed into a way of coping with this once you have the more natural physiological baseline back in place. And so sometimes that's how this plays out. Sometimes medications of, any number of different medications may be used to help create buffers and protection walls and ability for you to cope a little bit better for a while and then taper off of that as you gain more skills. Or you may be somebody who is neurodivergent and needs those medications permanently because that's just the best way for you to function. And so it's going to be very individualized, but what we're looking for is a level of increasing tolerance so that your landscape is expanding over time, that your ability to tolerate and look at the landscape and navigate the landscape and then expand this so that the trauma is only one part of a wider life. That's the goal. The goal is to create that wider landscape and acceptance of that landscape and ability to navigate that landscape so that you are an integrated person that has pillars of identity that can withstand the tests of life. Even if there is further trauma, that you have tools with which to minimize those kinds of things from adversity turning into trauma in the future as best as possible, right? We can't control what's going to happen to us, but we can do what we can in terms of working with other people to help us navigate this and gain support so that adversity doesn't become permanent trauma. So that's kind of the spiel about this. Feel free to ask questions because there's a ton of nuance to it.